Good evening, everyone. I am Richa Sehra, founder and editor-in-chief Responsible Hospitals, and I would really like to welcome all of you on our Insta Live channel. As we always come up with a different kind of topic, and today's topic is what is the difference between the cesarean and the normal delivery? It's a very basic topic wherein people have been talking about these days, but then they are not even sure that what to choose and what are the various myths and facts which are related to it. Which is why we would have Dr. Pragya Goyal with us from Cloud9 Hospital, Chandigarh. She's a senior obstetrician and gynecologist. She would be helping us help with the right facts and myths so that it's quite clear to all of us that what decision needs to be done and at what stage. Good evening, Dr. Pragya. How are you doing?
Good, Disha. Hi, good evening. How are you?
I'm good. I can't hear you so well.
Okay. Is it fine now?
The sound is quite low. I don't know why. Would you like to use earphones or something, or maybe quite near to the camera or so?
Right. Just wait a while.
Can you hear me? Is my voice clear and audible to you? There's a network error. Maybe you can just use the earphones and then we can start.
Am I audible, Disha?
You are audible, again, but the sound seems to be quite low.
Quite low.
Maybe you just can come a little closer and be a little louder. That should help. Yeah.
Okay.
Yeah. It's better right now, I think.
It's fine now?
Yeah. Yes,
Or
it's
I
quite
can use
better.
the
Good.
earphones also.
So,
Just wait a
yeah,
while. I
so
can use
thank
the
you.
earphones. Just wait a while.
It's quite fine right now. Your face is not so clear.
Fine.
I can't see you properly. Maybe lower the camera a little bit. Yeah, should be okay
It's
by
okay?
now. Yes, perfectly
Okay.
fine. Thank you so much. Sometimes it takes time to,
Yeah.
work on the
Yeah.
technical parts. So, Dr. Pragya, first of all, I really would like to thank you for being with us. It's a great opportunity for the audience and for us as well. So today's topic is, what are the myths and facts which are related to the cesarean and normal delivery? Okay. So, starting with that thought, I think because a lot of people, even till date, they are confused what to go for, even if given a choice, and how to take a, right decision towards this. So, what's your take on it? And let's start with this fact.
Thank you, Richa, for inviting me in this platform. I'm really grateful to you, to Responsible Hospitals, and to Cloud9 Chandigarh for giving me this privilege to be here. And I'm thankful to all the expecting mothers and the audiences who are listening to me. Uh, if, according to the guidelines, if I can say, in the absence of maternal or fetal indications for cesarean delivery, a plan for vaginal delivery is appropriate and it should be recommended, ideally. And if the patient is having no other complication, her pregnancy is going on well, singleton pregnancies, no risk factors, and she should go for normal delivery according to the latest recommendations.
Sure. So, doctor,
Yeah.
let's start with a question wherein what kind of delivery options are available as of now?
Yeah. As we all know, there are two modes of delivery. Normal vaginal delivery, that is a natural process of giving birth to the baby through the vaginal canal or the birth canal. It is a natural process and it is a very good method because it's a physiological process. The other method is a surgical procedure called cesarean section, also known as lower segment cesarean section. And in this, it is done under anesthesia. It is a major surgery, and we give the incision in the abdomen and the uterus to deliver the baby. The ultimate goal of both the procedure, whatever method we use, it is to ensure that both the mother and the baby, they should be safe.
Sure, absolutely. That's the most important thing which we look forward. So, my question to you is that what all things they really impact, or what really what are the factors which really gives them a decision? How do they take the decision of going towards a normal or a C-sec? I would say.
See, the safest method of delivery for both the mother and the baby is, as I said, is an uncomplicated vaginal delivery. But there are certain conditions in which vaginal delivery is not possible. And we know beforehand also, like in the elective cases, we know beforehand, and the antepartum period also, that which cases we should keep for the cesarean delivery. Like, for example, if the size of baby is too big and the maternal passage or the birth canal is narrow, which is known as CPD or cephalopelvic disproportion. In these cases, normal delivery will not be possible, right? And if the position of the baby is abnormal, there's malpresentation like breech presentation or the transverse lie. In all those cases also, it can be hazardous to the baby to deliver normally. So we know beforehand, right? And if the placenta is low lying, known as placenta previa, in those cases also, normal delivery is not at all recommended, and cesarean delivery is to be done. If more than or equal to two cesarean deliveries, previous history of two cesarean deliveries of the mother is there, then also we do cesarean section. Or in the cases of HIV infection, herpes infection, for the safety of the baby, cesarean section is done. Sometimes a decision of cesarean section has to be taken during labor in emergency cases also, like in cases of fetal distress, when the baby's heartbeat gets low in the lower side, or the baby passes meconium. Then also we have to do cesarean section in emergency, or we have given the trial of labor and it is prolonged, delivery is not happening. Then also cesarean section has to be done.
Sure.
These are the few.
So let's say, the lady has complications, but then
Yeah.
still she would want to go, with the proceeding of normal delivery. I'm sure you get such queries from people who are older. They're like, whatever it is, try to make it normal delivery. So how do you deal with it, and what are the consequences they can actually bear if they actually pressurize and do that?
As I told earlier, Richa, according to the guidelines, in the absence of maternal and fetal indications for cesarean delivery, vaginal delivery is appropriate and should be recommended. So ideally we recommend to all the patients who are uncomplicated that vaginal delivery is appropriate for you. But still, if the patient's main motivation to elect a cesarean section is the fear of the childbirth, right? Due to that, we can give up the options, or we can counsel the patient about the analgesia and labor, like the painless delivery options or the epidural anesthesia. That can be discussed with the patient, and we should give options to the patient, right? And in spite of discussing all the risks and all the risk factors for cesarean section, like especially what she will be having the future pregnancies, like chances of repeat cesarean deliveries, and its possible complications. If still she insists for cesarean delivery on maternal request, what we say it is the maternal request, LACS on maternal request, then it can be performed, but not to be done before a gestational period of 39 weeks. We can go ahead with that only after proper counseling and after discussing all the risk factors in the future pregnancies for the patient.
Sure. So, doctor, as we have been seeing the scenario that suddenly the C-sec ratio has increased drastically, other than the normal deliveries, wherein there was a time when normal delivery was like on the top, and nobody even used to talk about the surgeries as long as there is a big I would say a problem. So, what do you have to say about it? What do you think? What's your opinion about it? Why it is happening so frequently? Why the numbers are increasing for C-section?
Uh, yeah, numbers are increasing of cesarean section because nowadays, if we compare with the previous era, they're working because of the education status. Women are working. They are marrying late. Increasing age is also the factor for the complications. What we say in the pregnancy that we get because of the increasing age. The number of complications are rising, so the number of cesarean section deliveries are also rising. Secondly, patients don't have any what I say patience for mothers nowadays. They don't have much patience to bear the pain, right? There is a fear of the
Right.
pain. That is the main motive behind increasing trend for cesarean delivery. And these are the main two factors: increasing age with the associated risk factors. High risk pregnancies occurring because of the increasing age. And secondly, what I said, the patience to bear the pain or coping the pain is much lesser nowadays.
So
These are the
I
main
think as
factors.
per you, what I'm understanding is it's at the patient side that they are not able to bear the pain. How about the
Yeah.
hospital perspective? Because a lot of people when they go for they expect they really would want to take a decision that which hospital to choose, which doctor to choose. What some people see these factors that this hospital or let's say this doctor is quite popular to give a normal birthing.
Yeah.
So, is it a doctor or hospital perspective too, rather than a patient perspective as well?
I think it is also a doctor in a hospital perspective because the in-laws or the family members, the elders in the family, they do insist when they come to us, they do insist that, madam, whether my daughter-in-law or my daughter will be having a normal delivery or you can deliver her normally or not. This is the first thing they ask. But in many cases, I have seen that at the time of labor, that same female is not ready to bear the pains. So it is also the patient's perspective also and the hospital also. All of the most of the patients they want normal delivery, but at the time of delivery maybe they find that the process of delivery very lengthy and mentally and physically exhausting also. At the time of delivery, they sometimes or most of the time they change their mind for the process of normal delivery. But yes, it is there. Lot of patients, when they discuss with their family members, they do come to a doctor who is delivering normally. More number of patients than who is doing cesarean section. That is true.
Sure. And so, what is how much time does it take for a full recovery for a normal delivery patient? I would want to ask.
Normal delivery patient after normal delivery, the recovery is much quicker. Even if you see the hospital stay, it is just 24 to 48 hours stay. The mother can start breastfeeding earlier, and she can resume her diet earlier in comparison to the cesarean section. And it only takes few days to few weeks to fully recover after normal delivery.
Sure. And how about the C-sec? How much time does that take?
Cesarean section, the recovery period is longer, and there may be more pain and discomfort around the surgical site. And it usually takes around 2 months, 6 weeks to 8 weeks the time for the recovery after cesarean delivery.
Sure. So, since we have just spoken about the recovery part, what do you think could be a complication for a person who has delivered normally, or let's say who has delivered through C-sec? Can there be any complications later on after 6 months?
Yeah. If we see the complications after normal delivery first, um, uh, these are the complications that the process of as such, as I said, going through labor and vaginal delivery is a long process and that can be physically and mentally exhausting to the patient. And during the vaginal delivery, there is a risk that the skin and tissues around the vagina could stretch and tear that could cause weakness and injury to the perineal muscles, pelvic muscles that control your urine and bowel functions. So, due to this, women who delivered vaginally are more likely to experience urinary incontinence. It is actually urinary incontinence is the leakage of the urine when a woman she coughs, sneezes, or laughs, and she can have a pelvic organ prolapse due to weakness of the perineal muscles later on in life also. And if a woman had for the baby, if she had a long labor or she has long labor and the baby size is good, and if we keep on trying her normal delivery, the baby may also get injured during the whole process of vaginal birth. These are some of the few of the early and the late complications that a woman can have after vaginal delivery. And regarding cesarean section, cesarean section, it is generally considered a safe in some situations and can be life-saving, but they carry risk also because typically they require a longer hospital stay, and recovery takes a longer time after cesarean section, and there can be more pain and discomfort in the abdomen around the surgical site. These are the immediate complications, and in the to the baby. After cesarean section, the babies who are born after cesarean section, they are more likely to have breathing problems at birth. So these are the few of the complications. Also, during surgery, when we do cesarean section, there can be anesthesia complications. There can be more blood loss after surgery or during surgery. There is also more risk of blood clot formation called thromboembolism after cesarean delivery, and there is also risk of wound infection, and there may also be risk of, as I said earlier, future pregnancy complications such as placental abnormalities and uterine rupture, scar rupture, etc. in the future pregnancies after cesarean delivery. Yeah.
Sure. So what are the, after listening all this, I think it's such a difficult decision for a woman to take it up, if they really want to, that what to choose. So I think this question might help them. What do you think are the pros and cons, direct pros and cons for a normal delivery or a C-section delivery?
Pros, cons I have already discussed. Right now I've told almost all the cons
of
of
the pros, maybe that helps
pros
them.
is after normal delivery, there's as I said, shorter hospital stays. Their recovery is faster after normal delivery. Mother is able to begin her breastfeeding earlier, and there is most important is lesser bleeding after normal delivery in comparison to the cesarean delivery. Also, for the baby, most important thing is the muscles involved in the process of vaginal birth are more likely to squeeze out the excess fluid from the lungs of the newborn. And because of this, it is very beneficial to the baby. And because of this, the babies are less likely to suffer breathing problems at birth. And what the pros of cesarean delivery are, if the mother or the baby is in danger, a cesarean section can be life-saving. This is the most important reason that we do cesarean section, to save the life of the mother and the baby. Secondly, a woman may choose to have a C-section if there is extreme anxiety about the whole process of vaginal birth, right? And the women who have cesarean section, they are less likely to have urinary incontinence, as I discussed earlier, and pelvic organ prolapse in comparison to normal delivery.
Sure. What are the precautions to be taken once they delivered normally?
After normal delivery, usually ask the mother to resume her normal diet, and she should start her breastfeeding earlier. She can ambulate properly, like it's a normal delivery. She need not to take much rest, and she can go ahead with the good nutrition. Need not to take any extra advice from the elders regarding the nutrition. She should be taking her normal nutritious diet, and she should avoid because as we give the episiotomy or the cut in the vagina during normal delivery, she should not, we should tell her to avoid squatting position for a few days, a few weeks, and to avoid constipation. And she should not lift heavy weights for some time. These are the normal precautions we advise to women after delivery, after normal delivery.
How about the C-section?
C-section, same as such as she should take good nutritious diet. Ambulation is very important after cesarean section, because most of the women they think that after cesarean section I should take rest as I have a major surgery done. So ambulation is very important so that clot formation does not occur, and her constipation is relieved. And she should start her breastfeeding as early as possible, whenever she feels comfortable. And she should take care of the wound and she should shower normally, and taking care of the wound is very important. And she should keep herself well hydrated, and lifting of heavy weights are also, she should avoid to lift heavy weights, I say. That is
Sure.
normal precautions. Yeah.
Sure. So, doctor, my last question to you is that any message or advice would you want to give it to the expecting mothers before they take up such decisions, like they want to go for C-sec or a normal? Let's suppose they have the, the body's fine and they can take the decision. So, what is your advice to them?
In the end, I want to convey to all the expectant mothers that though vaginal delivery is safe and it should be opted first, but cesarean section can also be beneficial to mother and the baby, right? So, whatever the mode of delivery, the ultimate outcome must be safe mother and safe baby. That should be the ultimate outcome of the whole process of delivery. So they should keep in mind, right? If a normal delivery is going on well, patient is also, mother is also prepared for normal delivery. Everything goes on going on well. That's fine. Normal delivery is a very good option, and it is a safe procedure. But in case cesarean section has to be done, then it is for the benefit of the basically mother and the baby both sometimes. So healthy mother and healthy baby should be the our motto.
Absolutely. Absolutely. Doctor, I've got a question also. Are there any
Yeah.
long-term risks for C-section delivery?
Pardon, long term?
I just got a question that
Yeah.
are there any long-term risks for C-section delivery?
Long-term risk, basically, the long-term, what I said, it is basically for the future pregnancies, right? There are chances of repeat cesarean section if the delivery is done by cesarean section. If she conceives in the future, repeat cesarean section, and because of that, future complications can occur, like placental abnormalities, like placenta accreta, percreta. These are all the placental abnormalities that can occur in the uterus because of the scar and the placental abnormalities. And during a pregnancy in the future, she may have chances of scar rupture, uterine rupture. All these things can be very threatening to the mother and the baby, and sometimes excessive amount of blood loss occurs. Postpartum hemorrhage, antepartum postpartum hemorrhage can occur, and life of the baby and mother can be at risk. So these are the future few of the complications that can occur, and we have to go for the cesarean hysterectomy in those cases who are complicated because of the previous cesarean deliveries.
Sure. Got it.
Yeah.
Thank you so much for your time, doctor. It was really great and it was quite informative. So we really thoroughly
My pleasure.
enjoyed it. And thank you so much for being with us. We'll connect that soon again.
Thank you. My pleasure.
Thanks.
Thank you so much.
Thanks. Thanks for your time.
Bye.